July of 2019.
Yeah.
So by December 2020, I was a band 6. Thank you for having me, Sabrina. My name is Ese Journey. First of all, I'm a mom of two beautiful daughters, married for about 17 years, and I'm a registered mental health nurse.
Great, and thanks, Eunice. And but also, when I first met you, because you've got an incredible journey. When we
Yes,
first met, you were a clinical support worker. How long ago was that?
that was in 2010.
And fast forward
Mm,
13 years, I've met you up again, and now you're not just a registered nurse, but you're a band 7 nurse. So you've
yes, I
done
am.
your training and have had an amazing journey. And I really wanted you to share your story of how you went from a support worker to now a really senior nurse. So what made you decide to go and do your nurse training when you were a support worker? Tell us about your journey.
Yes, my journey is an interesting one, and fortunately, you're part of the people that inspired me to do my training. When I started, even before I came into NHS, I came into NHS in 2010. But prior to that, I was doing agency work as a domiciliary carer. So I
Hmm.
actually started from the scratch.
Yes.
Been there, come rain, sunshine, snow, going into people's homes as a healthcare assistant. And then I came into the NHS in 2010. That was when I met Sabrina, and I started doing this job. I enjoy looking after vulnerable people, people that are struggling with mental health conditions. And whilst I was in that role, I felt I needed to make more impact because my role was
Hmm.
sort of limited, most especially when it comes to making important decisions. And sometimes I have opinion about things, but sometimes because of my role, I felt I wasn't really
Hmm.
listened to. So I was like, okay, what am I going to do? But then looking at my financial circumstances, my whole mom of two, my children were still quite young then. And I remember, I don't know, Sabrina, if you remembered, I came to your office, the back office then. I was like, Sabrina, I want to do my training. And I was like, I'm looking at my finances. And I remember what you said to me, listen, don't think about now, think about the future. So that struck a chord home, and I thought really hard about it. I was like, okay, yes, I'm going to do it. I discussed with my family and I started my journey. So
Hmm.
I went and I did my access to nursing. So I resigned and I started my training. It wasn't easy. I'm not going to lie.
Yeah.
It was
Yeah.
difficult. I had challenges at uni, going for lectures, placement, and then I'll have to come back home and look after the family. It was hard. I don't know how, but in all of this, I had a strength
Hmm.
in my family. But then everything I do, I'm a very religious person. It has always been the center of my success. My cohort was the last cohort that
Uh-huh.
got the bursary. No, the bursary was just for transportation for me. It wasn't paying my bills or anything. Holiday, I'll have to go do some bank shift just to meet up, financial wise. But yeah, it was a struggle, but I persevered. Like I said, I'm a mom. I want to set good example for my children, and when you start something, you finish. And when you're telling your kids, you try to encourage them, you have to be an example, a living example for them. And my children are very proud of me.
It is difficult doing the studying and then the placements and then all the assignments in between. It's not like a normal university course, and I think people need to understand that. But fast forward 3 years, you were qualified. What happened after that?
My experience as a clinical support worker was on acute setting as well.
Hmm.
But as a nurse, I need to go back. Okay, what are the nitty gritty when dealing with acutely unwell patients? When it comes to the clinical aspect now, the actual clinical intervention. So I had to go back to acute. So I started
Hmm.
my career male acute unit,
Yeah.
and it was 18-bedded male acute unit. It was intense. I saw different kind of illnesses, people coming in with different kind of challenges. But because of my years of experience as a clinical support worker and my nursing training, I was able to, you know, handle it. My training as a nurse was intense, and every single placement, I took it very seriously. And I knew because of that training. I remember when I first, after my induction on the unit, on the ward,
Mm-hmm.
first day in numbers, I came on shift and I was the only qualified. I was like, okay. Yeah, I said, okay. Only qualified with 3 support workers, 18 male unwell patients. But I pulled through. Why? Because of my background.
Mm-hmm.
It made me stronger, and it made me, I was able to communicate with my patient. I, my focus was to maintain safety.
Yeah.
That ensure that everyone was safe until the afternoon shift through. And yes, and after that, I was there for 9 months. The male acute. Then I'm someone, I like to expose myself to new challenges. I don't
Mm-hmm.
like to remain in one position because I believe when you expose yourself to new challenges, it makes you a better person. And for me, that is what has happened all through my journey. So I was a male acute for like 9 months, and then I left. And I always think about the next step. So I
Mm-hmm.
said, okay, I want to have the busy A&E experience. So I joined the A&E experience with the psych liaison team at UCLH, and I was there for another 7 months. I think it was the peak of COVID.
Mm-hmm.
So many things happened whilst I was there. But again, that was another experience under my belt. And I went to another trust, South London as St. George's, the home treatment team experience, because I know when I first started, I was afraid. This is like I'm making clinical decisions on my own now.
Yeah.
When I go and assist patient, most especially when we have these new referrals, you don't know these people. When you're on the ward, you have the support of your team. You work like you have 5 people, maybe 3 qualified, 2 support workers, and then you have the doctors, everybody around you. So you have that support system around you. But in the community, you have it when you go into the office for handover. But when you go on your visit, basically you're on your own. And then I'm going to these people's homes. I don't know them. They don't know me. I had to be making clinical decisions. I was shadowing my colleagues. My confidence started
Mm-hmm.
increasing. I was becoming more vocal during the MDT meetings. I was putting my point across. I was
Mm-hmm.
just picking up learning for people that are more experienced than myself. And I remember when we had a new manager in the team. I think I was like 6 months in the team.
Mm-hmm.
He came in. I didn't even know because I pick things quickly. When I join a team, I like to study how things are done. And I remember him when he asked for something, I have the answer. When he asked, I have. And then one day he said to me, "Ese, how long have you been in this team?" He was like that he doubted it, that he thought I've been here for years. I was like, why? He said, because I know everything. And I took that as a compliment. I never allowed it to get into my head to stop me from wanting to learn. You
Yeah.
know, rather it makes me want to even know more. So yeah, I enjoy that role immensely. I
Mm-hmm.
mean, it led to who I am now. As in my current role as a nurse practitioner in the home treatment team, what I am now, that really, really contributed to it. Then when I left February last year, I came back
Mm-hmm.
to my home to where I started my journey, Slam. February last year, and this
Mm-hmm.
time I came as a deputy ward manager. And
And is that a band 6? So when you left from the male acute ward to go to the A&E or psych liaison, did you go as a band 6, band 5?
5, and then I went to Southwest London as a band 6.
Okay.
Qualified July of 2019.
Yeah.
So by December 2020, I was a band 6. Back to Slam February
Mm-hmm.
last year as a deputy ward manager, still a band 6.
Yeah.
That helped me in my managerial skills. I was able to manage a team. I got the experience of, getting involved in organizing the health roster,
Mm-hmm.
ensuring that my staffing are intact. And I built a very good relationship with the people I work with. And
Mm-hmm.
everyone I work with, I carry them along. I don't micromanage people. I respect people, and I ensure that, okay, we're all adults. I delegate and I expect you to do what I've asked you to do. And I always say, can you let me know if you are struggling? I always say, if you don't know, let me know. I will show you. And I enjoy that role immensely. It made me stronger in my clinical decisions. Then I left there. That unit closed, so I went back into the community, rapid response team, still within SLAM. That is another one. I was going into. I didn't. Now it's a different. It's a different scenario. Apart from going into patient home as well for emergency assessment, I was also going to GP surgeries as well. So I had the experience of, interacting with other healthcare professionals, receiving calls from GP surgeries, asking me for my clinical opinion. It's been amazing, honestly. I just say to myself, oh, is it me now? I'm speaking to GPs, they're calling for my opinion, they're asking me for my specialty, respecting my experience. I'm like, wow. So that service had to merge with another team. So where I am now as a band 7 nurse, which I still pinch myself sometimes, is a new service within SLAM that just started, and it's been amazing. I mean, I met the CEO of the trust and the chief of nursing. Who knew? For me, it's a great honor, and I don't take it lightly at all. And I know Sabrina is a very special person in the trust as well. And I'm very privileged that she's my friend. I can call her my friend.
From qualifying in 2019 and having those experiences, but also seeking them out, like thinking, I want to know this, but also thinking, when I'm in a team, I need to pick that up yourself. Tell us a little bit about your current role and some of what you like about it and some of the challenges that you've had to face.
It's similar to the A&E experience, cyclism, but it's different. So our role, we are like, in the country as a whole, A&Es are struggling with mental health patients, with the amount of time they sit in A&E, the condition they are in, the amount of hours they have to wait to be seen. So our department, we're trying to reduce that wait in A&E. So when a patient, for example, has been identified to go in for an informal admission, and you know how it is in the country right now for mental health bed is so difficult. I mean, it's one of the challenges that we are facing as well. So instead of just sitting endlessly and that environment in A&E, they can bring them to our unit, whereby it's a more therapeutic environment. And it also gives the patient time to actually reflect what they actually want. Because in most cases, since we've started, a lot of the time, when they're waiting for the informal bed on our unit, we continue to review them, and a lot of the time, they change their decision about going into hospital, because that is one of the things we aim to achieve, to prevent inpatient admission. And we've been achieving that so far, except if it's really, really critical and necessary for that patient to go into hospital. Then, but in most cases, when we carry on with the reviewing, we explain other options that are in the community for the patient. Most of the time, they choose those options that we sell to them, and they feel. I remember there was a patient that was brought to us, I think about 2 weeks ago. And sometimes they don't even know that these resources are available to them in the community. And this young man, he was so distressed. He was physically shaking. When I went into the assessment room, I saw that he was not in a position to answer any question. So because of my years of experience, even though it's not so long ago, I held his hands, said those words. I said, you're in a safe place. Because coming into the unit, he felt like, okay, am I going to be locked away? He was crying. So when I held his hand, he squeezed my hand so tightly. I said, you are in a safe place. We're here to support you. We're here to give you the best care, and you can trust us. And then he held my hand and he said, thank you so much. So I said, take a deep breath, have a glass of water, let me know when you're
Mhm.
ready, then we can start. At the end of the assessment, initially when they brought him, he wanted to go into hospital, and he said he loves to go to gym, he loves cooking and all that.
Mhm.
But one of the challenges he was coming up with was sleep
Yes.
deprivation. And I tried to explain what the inpatient setting is like. I said, I'm not going to lie to you. If they find a bed for you now, you go in. There's so many patients that might not have similar presentation as yourself. There might be a
Yes.
lot of patients who are completely unwell, shouting, banging, alarm. So I told him that. I asked him if he knew about the home treatment team, and he said he didn't know. So I had to educate him about the home treatment team and the services the home treatment team provide. And
Mhm.
after explaining both options, I gave him the choice. I said, which would you prefer? And then he said he would rather go with the home treatment team. His mom and aunties were coming, and he's got the family support along with the home treatment team support. He would rather sleep in his bed. He preferred to still have the opportunity to do his cooking and do his
Yeah.
exercise. So I was satisfied. I gave him that choice. I didn't impose my decision on him. I just educated him, and he made the right choice. And at the end of the day, when he was leaving, I remember I think I was in the back office, and he was looking for me frantically. He had my colleague, he wanted to speak to me. He said, "Thank you so much. Thank you so much." I was happy with that decision. So other healthcare professionals don't really have the full understanding of what we do.
Yeah.
So some of them are still of the opinion that we are an inpatient ward, but we are not. We're an assessment unit. And most of the times we just have to keep repeating ourselves. One of the other challenge that we're struggling with at the moment, allowing people to understand what we do.
Communication's always key, isn't it? And you find in nursing, you always have to keep communicating.
Yeah.
So you've had an incredible journey, Ese. What some of the things that, other than your curiosity and willingness to learn, but also to stretch yourself and your learning, what are some of the other things that you think might have helped? Because I know lots of people listening and want to know how they can either change jobs, move roles, and move up the ladder or develop themselves. What are some of the tips or advice you'll give to people?
For me, whichever team I'm in, I always look for that one or two people that they've achieved tremendously in this field, and how
Mm-hmm.
they what they do, how they carry themselves, their skills, their style of communication with patients. And I've been fortunate to work with tremendous nurses. And even in my current role, I have amazing, amazing leaders that I
Mm-hmm.
respect and admire so, so much. My general manager, the service director, I respect them. They are amazing leaders. And I just want to be like them.
The role models around you and sort of mirroring what they do.
Wherever I am, I know my stuff. Wherever I am at that moment, learn what is expected of me before I move to the
Yeah.
next stage. That's what I do. I don't just fly without an aim, you know, gain as much knowledge, and then I always know within myself that it's time to move.
The other thing that I always ask people sometimes is, as a band 7, what is the pay structure? Because some people just don't understand how much a band 7 earns.
A little over 40,000.
Great. And any final words? Is there anything that you've thought, oh, I wanted to say that I hadn't asked you that you wanted to share?
For me, I just think never limit yourself. You're stronger than you think. If you have a desire in your heart, don't let go. Focus on it, pursue it, persevere, and don't give up. And if you're
Great.
like me, back it up with prayers.
Thank you so much, Eunice, for your time. I know lots of people are going to listen to your story and see themselves in you and go out there and be bold and brave. And as you say, put God or prayer into it, because you're a religious person and a believing person. So thank you so much.